It is the voice of Indiana County. It's WCCS 101.1 FM, AM 1160, WCCSradio.com. Oh, the name is legendary by now, Brian Walkowski. Dr. Brian Walkowski is with us, IRMC, as we talk about weight loss surgery and the seminar that is actually happening. That's tonight, isn't it?
Back. So the seminar is tonight at 6 p.m. at the Wellness Center. And at the session tonight, we go over just the basics of weight loss surgery. I give the ins and outs, the indications, and then also I think the most beneficial part of the whole seminar is to have a few of our post-op patients talk about their experiences. And I had a patient in the office the other day who told me that was actually what persuaded her to undergo the surgery, just hearing from prior patients and their experiences.
Wow. All right, our visit presented today by Marcus & Mack, voted best law firm and best personal injury lawyer 3 years in a row in the Best of Indiana County contest. Visit them online at marcusandmack.com. I'm guessing that a lot of the folks who undergo bariatric surgery at IRMC do so after having attended one of these seminars and really being informed about what it's all about.
Mm-hmm. Yeah, absolutely. You have to be well informed about the process because it's not for everybody. It's a comprehensive process that takes about 6 months. They undergo evaluation by a mental health professional, our in-office dietitian, and then they have to meet certain milestones in order to be eligible for surgery. So a number of our patients attend one of the informational seminars, but a lot just self-refer or are referred by their primary care provider or another specialist.
Yeah, I'm guessing, though, that these things are really going to let you know what you're getting in for.
Absolutely.
Because there are different types of weight loss surgery, number one.
Yes, so several different types out there. I offer two here in Indiana. The first of which is the sleeve gastrectomy, and that's where I remove about 75% of a patient's stomach, leaving them the stomach about the size of a medium-sized banana. And the other surgery is a gastric bypass, and that's where I actually create a very small gastric pouch, which limits how much food they can eat, and then I reroute a portion of their intestine that contributes to some malabsorption. And those two procedures, about nationwide, they account for about 80% of all the weight loss surgeries being done.
Are those based on preferences or medically informed decisions?
So how much time you have? So that's a loaded question, and there are a lot of factors that go into that decision. A lot of that is patient preference, doctor preference, and then it's a customized approach based on that patient, what they're most comfortable with, what their medical conditions are, and I usually steer patients towards one or the other procedure based on their complete profile and what conditions they have.
You know, it's interesting you put it that way because this really is a very personalized approach, isn't it, to weight loss?
Yes, it has to be because there are so many factors that go into weight. It's not just diet and exercise, but there can be underlying mental health issues, a lot of other conditions that contribute to their food choices, and also some social ramifications. So in my mind, if you're not addressing some of those underlying features, you're setting the patient up for failure, and we're certainly not in the business of doing that. So you have to understand all the things that go into people's food choices and customizing a plan that's going to work for them, both in the lead up and the follow-up after surgery, but the surgery itself.
Yeah. So that being the case, if you are customizing a plan per patient, it seems fairly obvious to follow that the bariatric surgery isn't something you walk in one day, you get the surgery, you walk out, and everything's done. It's a real process.
Right, and that's something of a misnomer, too, because a lot of the misconception out there is that bariatric surgery is the quick or the easy way out or even the cheater's way out, and that couldn't be farthest from the truth. And the people who know that best are the people who have undergone it. And we often shake our heads in the office whenever they're confronted with that. But it takes a lot to get to that point. And just because they have the surgery, there are very specific things that they have to do afterwards. And that's for life. So it is not just a matter of getting the surgery and the weight comes off. There's a lot that has to go into that.
Part of that is that you mentioned it. It's a team thing.
Mm-hmm. Absolutely. Has to be. So it's not only myself, but I'm fortunate enough to be part of a institution that values its providers and provides them with whatever resources we need. We have two providers in my office. I handle the surgery aspect, and then I have Dr. Nirvana Mahmood. She handles the medical bariatric side, and we are the only two obesity-certified physicians in all of Indiana County. And we also have our wonderful coordinator, Haley Robson. We also have our dietitian, Lori Smith. So and all the other providers that come along with it. So it truly does take a village to get these patients ready for surgery and to be a success afterward.
So with the seminar happening tonight, folks are going to hear that you're getting in for a process, and that process is not just only going to be this one-time thing, but you're talking about a lifetime change.
Yes, yes. So it's, of course, it's the 6 months beforehand, but it's a lifetime afterwards of making sure that they are on appropriate multivitamins, make sure that they're having appropriate dietary follow-up. So it's not just simply a matter of getting the surgery and saying good luck to you, but those patients have to be seen routinely afterwards.
And that being the case, there are benefits that are just going to be far beyond probably what people are imagining. Mm-hmm. Probably somebody considering bariatric surgery is saying to themselves, "I just need to lose the weight. I need to look better, mm-hmm. And maybe feel better and be able to move about better." Mm-hmm. But the long-term benefits go up and down the whole health scale.
Yes, there are no other interventions, at least none that I'm aware of, that have that degree of positive health benefits. And of course, it's called weight loss surgery and the weight loss that comes along with it, but it's all the things that you gain as a result. And some of those things people aren't necessarily aware of. So virtually every organ system you can think of is going to be improved, from diabetes, high blood pressure, mood, thyroid function, decreases risk of heart disease, stroke, heart attack, increases life expectancy. Even women who are overweight and are looking to become pregnant in the near future, weight loss can help with fertility, actually. So a number of different things that patients get. And of course, one of the earlier things we see is for patients who have a lot of joint pain related to their weight, one of the first things to improve is that relief in joint pain, and that can happen within a matter of weeks after the operation.
Yeah, sometimes you see those things where somebody's holding a big bag of oranges or a sack of potatoes, mm-hmm. and they're saying, "This is what I used to be carrying around."
Yeah, yep.
And I no longer am.
Yeah, absolutely. And we've had a number of patients who have lost well over 150 pounds. And it's amazing what they've gained afterwards, and they're able to be, more participatory in their own lives, in their kids' lives, and their spouses' lives. And oftentimes they use that as a springboard to do what I call a little bit of spring cleaning, and that the relationships with people in their life improve, and they're just the best versions of themselves.
Dr. Brian Walkowski with us this morning. The surgery seminar is tonight, actually. It's at the S&T Wellness Center along Shelley Drive. You can still get in. It's free. Give a call to 357-7188 and get yourself registered for this to get all the information that you're going to need about bariatric surgery, the various weight loss options offered at IRMC. When you were here a while back, you were mm-hmm. talking about there was even some research that certain cancers mm-hmm. Are not, well, certainly mitigated, but mm-hmm. but maybe even be able to be prevented mm-hmm. With weight loss.
Yeah, absolutely. There are at least 13 different types of cancer, and it sounds like we're discovering additional types every other day. But that's not something that people routinely associate with weight or weight loss, is just their ability to prevent certain types of cancer. And that can range from pancreatic to breast or even colon cancer that we found have links to weight.
Yeah. Pretty amazing. Mm-hmm. Now, let's talk about the procedure itself when
mm-hmm.
you are in there. You have been aided greatly by robotics.
Yes, it's an excellent tool. So we're fortunate enough to have 2 Da Vinci robots at IRMC. I offer all of these surgeries on the robotic platform. The visualization is excellent with the magnification that we have. The instrumentation is excellent. I have 7 degrees of wristed articulation with each of my instruments, allowing you to be more precise. And I think that translates into an improved patient experience and outcomes. I remember in fellowship doing these cases with straight stick laparoscopy, and they would often stay inpatient for a couple days. Now our patients overwhelmingly go home the day after the operation without any narcotics, just on Tylenol. And that tends to be the norm rather than the exception.
Wow. Mm-hmm. It has to be a pretty exciting thing just to watch the developments in robotics, but just overall.
Sure. Oh, yeah. It's amazing the ways that we're using technology now. And as we were talking before the segment about AI, we're starting to integrate that into our office, also into surgical procedures out there. But it's an exciting time to practice.
Wow. So this is all happening tonight, the informational session, 6:00, S&T Wellness Center. You can go to irmc.org/2025. And you're going to have the team there. So, and people can ask whatever questions they need to ask.
Sure, they can ask whatever questions they have of myself and my team, but I think where the true value is asking our patients who have been through this process before, because I can tell them what it's like from my standpoint, but I'm not there with them day in and day out where the rubber meets the road, so to speak. So having our current patients there, I think, is a huge resource for patients who are on the fence or maybe considering surgery.
So you will actually have some folks there who've been through this process.
Yes. Yep.
Wow.
And yeah, they're gracious enough to volunteer their time to come in because of how much of a positive impact it has had on their daily lives, and they want to be able to share that with other people in the community.
We've had some of those folks in with us, and they've talked about just the ability to pick up a grandchild.
Sure.
Things like that.
Sure.
To take a walk, walk the dog, things that they were not able to do before.
Absolutely. And it's different for everybody. And I like to say that people have hit rock bottom in certain respects before they come in, and that can be not being able to fit on a ride in an amusement park or being out of breath carrying laundry up a flight of stairs. So, or even a new diagnosis like diabetes. Oftentimes it takes that to get patients into the office, but I've never had a patient sit in my chair and say that they've regretted it and that their only regret is that they waited as long as they did.
Yeah, it's difficult to know when rock bottom is approaching.
Sure.
So why not do it now?
Sure, absolutely.
Before that happens.
Yep.
Yeah. All right, so the event is happening tonight, 6 p.m., and again, you can call 357-7188. You can also go to irmc.org/2025, and you can register in that way. When you have these things and you get a chance, maybe you haven't seen a patient who's been through the process for 6 months or so because they've naturally cycled through and they're on with their life. I bet you that's pretty exciting to you to be able to talk with them again and see their progress.
Yeah, it is. That's one of the most rewarding aspects of my job is seeing them at regular intervals afterwards. I see patients at the 1 month mark, 3 months, 6 months, 1 year, and then every year thereafter. And it's so empowering to be able to see these patients and remember why it is that we do what we do. To see these patients afterwards who have lost a considerable amount of weight, their diabetes is better controlled, high blood pressure is better controlled, joint pain is much improved, if not gone. And I always like to ask them, well, what things are you able to do now? And oftentimes they tell me, they're able to participate in activities that they never were prior, hiking, cycling, and their relationships with those that they care about are better. Their self-esteem has improved, so it's amazing the transformations that people undergo.
For a lot of them, a great side effect as well as they get to get a new wardrobe.
Yes. And I tell them not to invest in anything too expensive in the year or so afterwards just because the weight's going to be coming off pretty quick.
Yeah, yeah. Well, it's a wonderful program. You've established it at IRMC. The whole team is going to be there tonight. Once again, S&T Wellness Center. This is free, 357-7188, irmc.org/2025. Dr. Brian Walkowski, thanks so much for the visit.
Thanks for having me, Todd.
It is the voice of Indiana County. It's WCCS 101.1 FM, AM 1160, and WCCSradio.com. Jake is here in the WCCS newsroom. He's on the way right after Boomer Sports.